Good evening and welcome to Viewpoint. Tonight we're going to talk to professionals who work with the charity GibSAMS. We'll discuss the impact the pandemic is having on our mental health and what we as individuals and what workplaces can do to keep us well. That's coming up in part 2. First though, Viewpoint speaks to Health Minister Samantha Sacramento. We discuss her first weeks in her new role, the changes that she wants to bring about, progressing eGovernment, simplifying the booking of appointments digitally while retaining phone lines, and how the GHA could make more appointments available at the primary care centre. I first asked her about inheriting responsibility for health and care when she already had a lot on her plate. Ms. Sacramento's team tells me that she's been working 7 days a week since March. She's been Health Minister for a little over 4 full weeks now. We recorded this interview towards the end of last week. How are you settling in?
I've settled in quite well, thankfully. This is now the end of the 3rd week, and actually it feels as if I've been doing this job for longer because it's been a very, very intense 3 weeks.
Who do you work most closely with at the ministry?
At the moment, I'm spending my time in the hospital and I'm trying to familiarise myself with the various departments. So my first point of contact, of course, will be the Medical Director, Dr. Rawal, and my Principal Private Secretary, Evelyn Servan. They are the key people from the GHA and from the Ministry, and of course supported by our teams because the Ministry is made up of more people. At the moment, my team from my previous responsibilities are with me most of the time because we're all learning on the detail and as well as the bigger picture. We're just trying to familiarise ourselves with the new responsibilities as much as we can and as soon as possible.
You kept most of your former responsibilities or all of your former responsibilities?
I remain with all of my former responsibilities that were allocated to me just after the last general election.
Did you have to think about it when the Chief Minister asked if you'd be the next Health Minister?
When portfolios are given to you, it's not really a question of having an option. The Chief Minister is the person who decides who he wants his members of his government to do. And quite frankly, I was very, very honoured indeed when I was given the opportunity to become Minister for Health and Care, in addition to my other responsibilities. I know it's a huge ministry and it's a huge responsibility, but it's something that I think is a great privilege to do for Gibraltar. It's a very important ministry. I think that it probably could be one of the most important. Health is certainly something that affects every single one of us. If there's a ministry and a responsibility that I have to get right, it has to be this one.
It's been in many ways a roller coaster. You get many highs in politics, but also many feelings of frustration when things don't go that well. But it's been a hell of an experience.
It happened as a result or certainly coincided with the stepping down of Gilbert Ligudi, which surprised many people. Did it catch you by surprise also?
Yes, it did. I wasn't aware until we were told at a cabinet meeting. I was extremely sad, I have to say. I'm not one who is generally emotional, but I found myself to be very emotional to learn that Gilbert was stepping down as a minister. Gilbert has been a colleague as a minister. He's also been a friend. I knew him from before. We have been in government together, and Gilbert, I think, has been a great asset to our government, and it's been a loss to see him go professionally. And as a friend, someone that we will certainly miss in the cabinet.
And will you miss him sort of not just on a personal level but on a professional level because of the fact that there are now 9 ministers doing the work that previously was done by 10?
Yes, we'll miss him that way because some of us have more responsibilities as a result of us having 9 ministers instead of 10. As a friend, of course, we'll be in touch. Gilbert continues to be a member of Parliament, so we have contact as parliamentarians, of course, as well as our contact at a party level.
There's a lot of responsibility on your shoulders now. I mean, if there wasn't already, you've inherited health in the midst of the COVID-19 pandemic. I'll ask you about that in a moment, but let's check on your other weighty portfolios. Minister for Justice, for Equality, now for Health and Care, as well as civil contingencies, which saw you congratulated and thanked by the Chief Minister for working flat out for months to bring into law lots of changes with an ever-developing situation.
This is not a time to be walking up and down Main Street to socialise. This time will come, but it has not come yet.
A lot of responsibility on your shoulders.
Yes, there is a lot of responsibility on my shoulders, and I do feel it, of course. But it's things that I have to do. I have been entrusted to carry out these portfolios, and I have to give it my best shot. I have to give it 100%, and I will do it with the greatest dedication and to the best of my ability. Being a minister means that I have to be responsible for policy, and I have to be responsible for vision. What I have to do is work very closely with my teams. The minister is the person who sits at the top, but the minister isn't the person who discharges the day-to-day responsibilities, or I'm not responsible for the operational running of any organisation. That's the teams who do that. We've got very good teams, we've got very good public servants, people who are leading these teams in an exemplary way. What I have to do is get to know how they work so that we can work together. And of course, the volume of my responsibilities is huge. The breadth of my responsibilities is huge. So I'll just have to be even more disciplined in the way that I work, and make sure that I really focus so that I can do my job, and I can do my job well.
Are you concerned that, given, as you say, the depth and breadth of the policy decisions that you have to sign off, that there is a danger of some bottlenecks building up?
That's possible. It could happen. But I want to, in a way, change the way that maybe things have been done historically. In my first week, when I was appointed the Minister for Health, I met with all the heads of department in the GHA. I wanted to introduce myself. I wanted to introduce my way of working, my expectations from the organisation. I wanted the heads of department to tell me what they expected our working partnership to be going forward. And one thing that I made very clear was that I am accountable to the people of Gibraltar, but everyone in the organisation is also accountable for the responsibilities that they have. So in terms of a bottleneck, I want to work in a way that I want people to take ownership of their responsibilities and take their responsibilities, and maybe rely a bit less on the minister to take or influence any operational decisions, because that is not the role of the minister.
Interesting. So you want key people to be more empowered to make their own decisions?
As they should be, yes.
How do you think the GHA is handling the COVID-19 pandemic?
I think that the GHA and all its staff, from the top to throughout the GHA, have handled the pandemic extremely well. If we turn back and remember what things were like in March, and I know it seems like it was a long time ago, but back in March, we didn't know what to expect, nor did anyone else in the world, and we very quickly prepared for the worst. There was a lot of key people who were driving our policy decisions and advising the government in what we had to do. They were the professionals and the experts who we relied on for evidence and to educate us very quickly on what COVID-19 meant and the risks that it posed to our population. And I think that as a result of that, everybody in Gibraltar worked together to try and contain the situation. Gibraltar as a whole was very compliant, and I think that that's what made the difference. I think that that's what made us different to many other countries. We put in a lot of steps in very early on, and the whole point of that was to be able to protect pressures from the GHA. Now, having said that, GHA were very much on standby and ready to deal with a population where we would have had more people who could have been positive for COVID-19 and more serious cases. we have to be thankful that the kind of cases that we had were not as, even though we have had our share of positive cases, we need to look at the positive cases who required hospitalization. And then within that context, we need to look at the seriousness of those cases that required hospitalization. We've only had very, very few serious cases, but those medically and clinically, those patients have been dealt with extremely well. We need to look at the GHA, but we also need to look at the fantastic work that has also been done by the staff at the elderly residential services. Because what we had during the whole pandemic situation, when it was at its most acute, we had a hospital that was on standby and was ready to deal with the worst case scenario. Everyone was ready, from clinicians to the intensivists, and we were ready with the ventilators and anything that needed to be done that way. We also were ready from a psychological support point of view, because we also set up a welfare and well-being team specifically to support frontline staff in the FRIM training that they were delivering. So we had a hospital that was ready and on standby to deal with that. But then on the other hand, we had elderly residential services, and Montalvernia in particular, which is the same size as the hospital, but that was full of residents who were the most vulnerable people in our community, because we have frail elderly people living in our elderly residential services, not just Montalvernia, but all the others. And they were running at full capacity with the same risk. And indeed, we had positive cases both within the patients and the staff who were working there. And that demonstrates our preparedness to deal with COVID-19, because we have not yet lost anyone to COVID-19. And that's because we were ready to deal with them. We were ready on our PPE. Everybody knew how to use PPE properly. We took, I think, the right decisions at the time to lock down our services. And in terms of the serious cases that we have in the elderly patients, I think that the medical and the clinical support and treatment that they received was magnificent.
Where do you think we're heading in terms of caseloads and the winter months bringing other normal seasonal colds, schools having reopened, which are usually places where young children will pick up sniffles? And
we've seen our cases increase in the last few weeks. We've had a bit of a dip at the moment. We were expecting for our cases actually to have maybe gone up this week because of the combination of National Day and people, that there was a risk of people partying and congregating together, and that came at the same time as our schools opening. Thankfully, I think that, again, the behaviour of people in Gibraltar on National Day was exemplary. People followed the rules. We saw that there was really, hardly any congregation. People had a good time. People still celebrated, but obviously in a way that was more downplayed, and we haven't seen a result from that yet. We're coming into the season now where, of course, we expect people to start having colds and to start manifesting symptoms that could either be a cold or could either be COVID-19, but they will be treated on the basis that anyone who manifests symptoms, we have to take precautions and assume that it will be COVID.
The COVID preparedness that you've spoken of also meant that other things, the normal business of the hospital and the health authority more generally has seen changes. And we've seen quite a few complaints from people trying to book appointments in recent months, trying to see doctors and other professionals. What comment would you make to somebody who's experienced that frustration?
First of all, I'd say that things have changed gradually as we've come out of lockdown, because we found ourselves in different situations on the basis of the scenario that we found ourselves in the time, both in Gibraltar and in the neighbouring regions and globally. There was a time where almost everywhere that you can think of was in lockdown. Now that meant that we had to advise people to stay home, and it wasn't advisable for people to leave home. Now, of course, if there was an emergency or if there was something urgent, of course there was provision for that. So what we did was we made sure that advice and services continued, but that they continued in a different way. And just like the rest of the world, pretty much, what we did was we changed from face-to-face consultations to telephone consultations at a time where it was not advisable that people come into contact if it was not absolutely necessary. At all times, if someone has needed to see a doctor because on the basis of an assessment, a clinical assessment, that it was necessary, that service has always been provided. Now, as the months have passed and as the situation has changed and as we've been coming out of lockdown, then we've had clinics available to people at the PCC for a considerable amount of time. Now, what we're doing at the moment is offering two types of services. We continue to offer the telephone consultation, but we also at all times make available appointments with doctors. Now, I know that there have been various complaints in relation to the PCC. When I started this 3 weeks ago, the first visit, or the first department that I visited was the PCC. And in addition to meeting with the medical director, I also met with the senior management team at the PCC, the clinical director at the PCC and the nursing director, as well as the head of administration at the PCC. And together I asked them to look at the service holistically, to look at it from scratch, to see how we can improve the services that we deliver to the public. I think there are a few main issues that everyone will know are concerns. We know that there's a problem with appointments and with making appointments, so I've already met with the team at the PCC as well as the GHA's IT team to see how we can find different ways of making appointments available to members of the public. Obviously, we want to go down of the route of eGovernment to simplify the way that you can book appointments for yourselves, but we'll always have other methods available for people to whom eGovernment and that is not as simple. For example, elderly people. But the more people that we can steer towards the automation, it means that the more the phone lines will be freed up for those who absolutely cannot use any other method. So we're looking at that. We're looking at ways of changing how you book an appointment to streamline it, make it easier. We're looking at things that are very simple. For example, before, I know that one of the complaints was that people may be on hold at the phone while other people were calling in, only to be on hold for 30, 40 minutes and be told at the end of it that there were no appointments left for the day. We've changed that immediately. So if when you call, by the time you call, there are no appointments, then you'll be told immediately by an automated service on the phone that you're out of appointments. You don't have to wait 40 minutes to be given that message. So it's little things like that that we're doing immediately, but we've also got a bigger plan to see how we can revise it even more. So we're looking at the appointments. We're also looking at how we can make more appointments available by restructuring the way that the PCC clinicians deliver the services. We had a backlog on repeat prescriptions. That's been resolved. We have a backlog in relation to applications for GHA cards. That's better. It's not resolved, but we're looking at resolving it as soon as we can. So we're working on a plan for that. But generally, we're looking at the working practices. In addition to meeting with the senior management team of the primary care centre, I've also been able to look at other resources that I have available from outside the GHA so that we can have maybe a more objective outlook from people outside of the organisation. So I have other senior managers from other sectors of the public sector working alongside me and assisting me in these reviews. But at the moment, in terms of my strategy, what I want to do is focus on the primary care centre and see how we can make improvements. There already have been, I think, some very quick improvements. There will be some medium-term improvements, and hopefully in the long term we'll be able to change the way that we do things. One of the things that I'll be doing this week, in addition to things that we've already done, because as you know, we've already also introduced customer care training for people who are frontline staff workers so that they can have a better engagement with members of the public. I'm going to issue a survey because I want to hear from the public. Because it's one thing for people within the organisation to tell me what they think should be done, but it's another thing for the users to tell me what problems they're experiencing. And I want to hear it from the people themselves. I want to listen to what the problems are, and then I'll be able to analyse it and see what improvements can be made. But generally, I think that we also need to work on a bit of education and what the primary care centre is about, what services we have available, and how best to access them.
Okay, so in summary, it sounds like although you've only been here for 3 weeks, you're already on the way to conducting reviews in a number of different areas which you're hoping the healthcare user will notice an improvement on.
I certainly hope so, because that's the objective. At the end of the day, as a government, what we want to do is deliver high quality healthcare to our public in a way that just works for everybody. So yes, reviews have started, changes have already been put in place, changes have already started in the last 3 weeks, but we intend to continue. Health is something that affects us all, and we're all entitled to have an efficient and a good quality healthcare service made available to us.
The Minister for Health, Samantha Sacramento, who's launched an online patient satisfaction survey to obtain feedback from the users of the primary care centre. The purpose of the survey is for the Minister to understand the issues with the primary care centre directly from users themselves. The survey will be open for a few more days and is available online on SurveyMonkey and on the GBC website. You can also call the Office of the Minister of Health on 200 07 386. And the survey will be completed for you by an officer from the Minister's office. So that number again is 200 07 386. Stay with Viewpoint. We'll be discussing mental health after the break with GibSAMS. I should say, we didn't discuss mental health services with the Health Minister because she told us that she'd be publishing an audit by Public Health England of Gibraltar's mental health services next week. And that'll provide a great opportunity to talk about mental health services. So we'll do that soon here on Viewpoint. Stay with us, we'll be right back.